I did a study, or we did a study at Loma Linda a number of years ago, and in ferrets. As you can see here, this is our negative control, and this is the cuspid that we didn't do anything with it. This is a normal cuspid in ferret that has not had any procedure. Coronal portion, middle portion, and apical portion. Now, when we extirpated the pulp completely and then we created bleeding, we had a different reaction. As you can see here, after 2 or 3 months, we saw calcification in here. What type of tissue is this? Is this pulp? If you look closely, this is not pulp. This is just bone growing in there. That was the coronal portion. This is the middle portion, and this is the apical portion. Now, if you leave 1 to 2 millimeters of the pulp in there and then create bleeding and then put MTA over here, you get a different reaction. As you can see here, there is a bridge here. And when you look at this, as you can see here, there is a bridge there. And this is a normal pulp here. This is the coronal portion where the MTA was. This is the middle portion. And this is the apical portion. You get even better results if you have 2 to 4 millimeters of pulp left in there. As you can see here, this is the cuspid of that animal. We left 2 to 4 millimeters of pulp in here, and then we created bleeding, put MTA in here, and this is how it looks like after 2 or 3 months. As you can see here, this is where the MTA was, a beautiful bridge, normal pulp in the coronal portion, in the middle portion, and in the apical portion of the tooth. And that has been also shown in case reports by Shimozo, Peng, and recently by Dr. Sabetti and our group at University of California in San Francisco. This was one of the studies or case reports that came in the literature. And what they showed was actually formation of pulp in the tooth that was having irreversible pulpitis because of the fact that the tooth was involved with an accident and was not saved. They went ahead and they extracted the tooth after pulp regeneration tried. As you can see here, this is normal pulp in there and the normal periapical tissues there. The same thing has been reported by Dr. Sabetti and his group at University of California. This came out, in February of this year. This is a tooth that has, this is a patient that has 2 teeth. This one has necrotic pulp with a sinus tract, and this one has irreversible pulpitis. This is the X-ray of it, or radiograph, open apices. And as you can see here, this one has necrotic pulp and sinus tract. So what they did was they went ahead, they left 4 to 5 millimeters of the pulp in here. They created bleeding above it. And then, as you can see here, and then they put MTA in here. And this is after 6 months. They did a region on the tooth next to it. This is after 12 months, and this is after 18 months. As you can see here, the apex is closed, and when you look at it under CBCT or with CBCT, the tooth is responding within normal limits, and the apices are closed. The other thing that happens is, I believe, if you have a case that the pulp has recently been affected and the pulp or the periapical, there's no periapical lesion, you have got a good chance of that. This is an example of it. So this tooth was accidentally taken out by a general dentist. Patients came to us, and we did the regen with the use of PRP, and this is after 5 months. As you can see here, the apices are closed, and the tooth was responding within normal limits, or actually it was hypersensitive. And this is after 14 months. The patient was complaining about sensitivity to cold and heat, and they wanted to be something to be done. So what we did was we went in there, we removed the content of it, and when we did histology, as you can see here, this is connective tissue, which looks like pulp. And then, we finished the root canal therapy. Another case, this is a young girl who was playing with her brother. They got into a fight or whatever, and this tooth came out. It's a Saturday night. The orthodontist put the tooth back. The patient came to me on Tuesday, and I did I just cleaned and shaped, and I used actually MTAD as irrigation solution, and I did the regen procedure with MTA. And this is after 18 months, the tooth is responding within normal limits, the apex is closed, and this is after 48 months. And this is the clinical picture of it. We got a little bit of discoloration, but I bleached it, and it looks like it's okay. So let's go ahead and conclude the lecture. Based on what we know, the pulp tissue has a great ability to heal if it is sealed well and it is covered with biocompatible material. And based on what we have in the literature, vital pulp therapy has an excellent outcome. And pulp regenerates when there is remaining pulp, or recently it has died and there is no periapical lesion there. And there are emerging materials and methods that they are being investigated to keep the pulp vital. With that, I would like to thank the AAE for giving us the opportunity to give this lecture, and I wish you a good holidays and stay safe. And if you have any questions, please do not hesitate to contact me at mtorabinejad@llu.edu. Thank you very much, and God bless you.